We want to discuss the reoperation, relatives, and race, individual proclivity to the oculocardiac reflex. From a stable baseline heart rate, a uniform tension on an extraocular muscle during strabismus surgery, through the trigeminal nerve and the vagus nerve, often produces a slowing of the heart rate called the oculocardiac reflex. This can be minimal, or some cases the oculocardiac reflex can produce a significant bradycardia.
That was 10 seconds.
So this is part of a review of over 3,200 cases monitored from 1992 to 2020. If a patient has initial profound oculocardiac reflex, if they have to have a reoperation, will they also have profound reflex? Would their relative have a profound reflex also? Is it dependent upon some aspect about them, like their race? Let's look how we define oculocardiac reflex. From a stable pretension to a tension oculocardiac reflex, using non-parametric data or mean and standard deviation, we see that there's a large variation between oculocardiac reflex. From a pre-heart rate to a tension heart rate with non-parametrics, the large variation means with an alpha of 0.05 and a beta of 0.2. To detect a 15% difference takes about 30 cases. To detect a 5% difference would take about 250 cases, but to detect a 3% difference, almost 700 cases. This means large numbers are required to tell details about the oculocardiac reflex. What about reoperations? We generate a control group by looking at age-matched intersubject differences and find this amount. Then we compare that to initial case and reoperation cases from this large study, 323 cases. Comparing those differences, we find there is no difference with reoperation. What about relatives? Again, generating our control group, the first degree relatives and the other relatives. With 28 sets, we would expect the difference to be smaller if there was a genetic proclivity, but there was no difference. In comparison, for each individual person with a two-muscle case, comparing the first muscle with the second muscle, that difference is significantly smaller. What about race? With 600 cases, Pacific Islanders, blacks, Native American, Alaskans, Hispanics, and whites, we find that whites have more bradycardia due to oculocardiac reflex. What about age? Preschoolers and school age compared to adults, the adults had less bradycardia. So let's understand that. There's no difference in proclivity due to relatives, iris color, and gender. There is a difference due to race, with whites having more bradycardia, and age, with adults having less. And there is a small difference with reoperation, perhaps related to neurological disorders. Thank you very much.